And when I try to approach the patient very professionally but casually enough that I'm a human, that they can relate to me. And I am a big believer in autonomy. That is, I believe people should direct their own lives. So the first thing I do with the patient is listen to their story, because the patient will tell you what their problem is if you give them a chance. Now, true enough, sometimes you have to direct them a little bit. Sometimes you have to coax the story out of them. But if you listen to the patient, I could almost always tell you what their problem is. Now, people want to know exactly what their problem is, which is a wholly different matter. I can tell them generally what type of problem they have. For instance, you have a deformity, you have a pinched nerve, you have a broken bone. And once you get into the realm of what type of problem they have, then the treatments become more obvious. For instance, if you have a disc herniation and you have a pinched nerve, your choices are basically two. You can have an operation or not have an operation. Now, the overwhelming majority of people don't want an operation. So under the topic of not having an operation, they can give it more time, they can go to physical therapy, they can go to a chiropractor, they can have a steroid shot in their back. What I do is have the patient educate me to what type of problem they have, and then I try and educate the patient to what their potential treatment options are. I follow all of my patients, and I pledge to my patients that if we choose to operate on them together, the patient and I choose to operate on the patient together, I will be their spine surgeon for as long as they want or until I retire, whichever comes first.